The subject of mid-facelift comes up quite a lot in my clinic because I do a lot of surgery around the eyelids and cheek. The mid-face is that part of the face below the lower eyelid down to the corner of the mouth. It's a very small part of the face, but it's very intricate in its anatomy. As we get older, the fat pads of the middle face, the mid-face, separate, and we end up with a Y-shaped shadow down the face. And that Y-shaped shadow creates three separate V-shaped triangles. And I call it the 3V mid-face as we age. And so what we want to do with a mid-facelift is to replace that shadow, banish that shadow, and introduce light. And the way that we do that is with a mid-facelift. And the principle of the mid-facelift is to balance the aesthetics of the lower eyelid with the aesthetics of the cheek, to remove shadow, that ski slope of shadow between the lower eyelid and the cheek, and to introduce light in a uniform light reflex. And it works beautifully well. The ideal candidate for a mid-facelift is really anybody who has that ski slope of light and shadow between the lower eyelid and the cheek. As we age, the fat pads of the face separate and create shadow. And so what a mid-facelift does is it restores the balance of those fat pads between the lower eyelid and the cheek. And so that elevates the mid-face, provides a light reflex from a youthful face, and can be best done really for anybody, male or female, between the ages of about 40 and 55 is the ideal time, where there's a youthful face that doesn't have a lax jawline or a lax neck, where the aging is pretty much concentrated to the middle part of the face. And we all see that in the mirror. The beauty of the mid-facelift is that it changes the reflection of light from wherever that light comes and provides a very youthful light reflex from the middle of the face. When we think about the results of a mid-facelift, what we're thinking about uniquely is banishing shadow and introducing light. And generally, the shape of that shadow is this Y between the lower eyelid and the cheek. We get rid of that, we introduce a nice curve, and the uniform aesthetic subunits between the lower eyelid and the cheek are made more uniform to reflect light. And that is what we want from a good quality mid-facelift, where the scar is hidden underneath the eyelash line and a millimeter or two beyond into the smile lines. I'm often asked about the side effects of a mid-facelift. The key side effect really is bruising and swelling to start with. The surgery is done in the deepest part of the face, but also in the deep part of the lower eyelid. So the tissues are very intricate. The aim of the surgery is to support the lower eyelid. And once the swelling is gone, we can expect a uniform lower eyelid shape and position of the lower eyelid margin and a uniform reflection of light from the cheek. The main side effect would be swelling, and it takes usually 2 to 3 weeks for that to subside. There can be some discomfort in smiling because the smile muscles are moved, and then everything settles down and the face returns to a youthful normal with normal sensation in the face and normal movement in the face. In thinking about the mid-facelift, we tend to think about it being a combination procedure between the lower eyelid and the cheek, which unifies both. Recovery time for me is really about back to work time or back to social life time, sitting across a table from somebody and feeling comfortable. And that is between 2 and 3 weeks after the surgery. As the surgery has become more and more precise over the years, the recovery time has dropped, the swelling time has dropped, and the opportunity to get back to work and the activities of daily living has become earlier and earlier. 2.5 to 3 weeks would be a reasonable time to anticipate recovery and to be able to hide the scars and to feel confident back in front of people.